My name is Bhawan Chehal, and we have traveled from California, specifically in Bakersfield, California. We have two kids with special needs that have autism, and we chose Giostar, specifically this location, because it was driving distance from the States. Being a family with kids with special needs, we needed something that was close, nearby, that we could drive versus being on a plane. So that was one factor. Second factor was the history behind it, with Dr. Anand having actually be a part of the research, not just a clinic that was opening up and giving therapy. There was the science behind it, and having their own lab on site, that made us feel very safe in terms of hygiene, infection control, the quality of the stem cells, and having a complete team on site. Also, when we were researching, we also really liked the fact that it was a complete package. It comes with, a dietitian on site, a nutritionist on site, there's an RN on site, a doctor on site, and it was really not just, oh, here's stem cells. You come for a week, and step by step they walk you through the process. So I really felt for our kids, it was a very safe and overall treatment plan, not just here's stem cells and therapy and then you figure out the rest. We have two kids that are autistic. They are both nonverbal. So our real thought process behind having stem cell therapy was to enhance their life. They are nonverbal, and they have issues with communication and sensory, and when you research about autism, knowing that it's not a cure, but it's treatment and it's therapy, and it's an alternative therapy to help their quality of life. We know with autism there's a lot of body inflammation. So one of the things that the stem cells do is target that inflammation. So we're fortunate enough to help with, if we can help with some of their food therapy, their speech communication, just the body inflammation, so they don't have as many sensory problems. Little by little, that helps them as they're growing to kind of cope with the actual neurological disorder they have. We brought my younger son in February of 2022, post-COVID. Dr. Daniel was awesome at assessing him, making the environment very calm. Everything was very clean, and infection control and hand washing. Everybody communicated with my husband and I step by step. And even afterwards, throughout the day, because we're staying locally on site in the Meta Plaza, the team checks on you the day after they check on you. And you're here for a few days. So it's really good that you get checked on, is he eating okay? Is he sleeping? Is there any signs of infection at the site? Is he holding his bandage? Any advice that I would give is, no matter if you choose Giostar or not, is to do your homework. Do your homework, do your research. Don't just read the internet. Call, get a consultation. If you can, speak to them over the phone, do a video call. One thing that I liked is when we did our consult via internet the next day, Jose reached out from patient coordination, and then we had nurses reach out, went over medical records with us. Dr. Daniel himself emailed and kind of told us, with the date and the protocol, what we would be doing. And you get that itinerary, and you know exactly what to expect when you're going to come. Don't feel shy to ask questions. I was nervous in the beginning to ask questions, but the patient coordination and the nurses would ask me, do you need anything else? Do you have any other questions? And then I started to open up, things that you would need, even accommodation-wise, even if it's not for the treatment, and if you're traveling from a different country, ask your questions. What are the protocols you need for travel? They let you know, and they give you suggestions. You can bring their medications, but we have everything else on site. Bring comfortable clothing. What is the temperature? What's the best time of year to go? If your kids are younger, and if you're fasting, ask for the earlier appointment. If you let them know, for our experience, everybody has been so accommodating. And so we just felt very comfortable every step of the way, even when I would be nervous, and they could tell, and they would be like, what can we do? Here, have a cup of coffee, sit down, we're with you. When my son went in for his first treatment, the office staff sat with me. the whole time. My husband went in the back with my son, and I just kind of sat there, and there's even like a massage chair to like sit and just calm yourself down, and just they're with you, they're supportive. They realize this is, your child, and this is therapy and treatment, but they also know the human side of it, which I feel like sometimes gets ignored when you're a parent, looking for treatments and therapy for your child. But it was above and beyond what I expected.